I believe we are live. Andrea, I'm going to just do a double check. It's still saying it's in a practice session. So
No, we are live. We are live.
We are live.
Oh, no. Sorry. You are totally right.
Good morning, good afternoon, good evening, regardless of where you're joining us from. Welcome to our latest installment of Insights in Qualitative Research Methods. My name is Juliana Barabbas. I am the program facilitator in the International Qualitative Research Toolkit based out of the University of British Columbia, Okanagan in Kelowna, Canada, although I'm joining you from Edmonton, Alberta, Canada. It's my pleasure this morning to be joined by Andrea Voicu from ATLAS.ti, Dr. Solina Richter and Kimberly Jarvis, who will be giving us the webinar shortly. A few housekeeping items as you are all joining us. We're going to be running the Q&A through the chat Q&A box. So any questions that you have, please type them into the Q&A box at the bottom of your Zoom screen. We'll be taking those questions after a 40 to 45 minute presentation by our two presenters. And we look forward to your questions at the end. I'll be reading them on your behalf. I'd like to now thank again, of course, ATLAS.ti and Indiana University School of Education for their partnership and support of this webinar series. And I'd like to hand things over to Andrea Voicu for a moment so she can give you some information from ATLAS before we get started.
Thank you, Juliana. First of all, I would like to welcome everyone to this session of Qualitative Methods Masterclass webinar series. On behalf of Neringa Kalpokas, Director of ATLAS.ti, I'm very pleased to announce that this series of webinars is organized by University of British Columbia and sponsored by ATLAS.ti, Software for Qualitative Data Analysis. The International Qualitative Research Toolkit offers two webinar series, Explorations in ATLAS.ti and Insights in Qualitative Research Methods. Through this series, we highlight a series of innovative approaches and practices in qualitative data in ATLAS.ti and in qualitative data in general, methods in general. We also strongly believe that sponsoring this project can help researchers from all around the world with their research projects. Before I gave the microphone to Juliana, I just wanted to announce a few things about ATLAS.ti. If you are interested in learning the software, we have a bunch of free resources. We offer overviews in ATLAS.ti, qualitative research or literature review. And also, because you are participating in this event, we are more than happy to offer a discount to all the participants in purchasing any license or any e-learning courses that ATLAS.ti is offering. Thank you very much, and I hope you enjoy this today's webinar. Thank you.
Thank you, Andrea. And I'd just like to mention as well, this obviously this webinar is being recorded and will be available on the IQRT, International Qualitative Research Toolkit archive. And you'll see that website later after we post our move to the Q&A. That archive site will be listed as well. Our two presenters today, Dr. Solina Richter's research interests focus on global health with special interest on vulnerable and marginalized populations, universal access to care, and sexual and reproductive health. She's conducted multiple international studies and supervised several Canadian and international doctoral students to completion. Dr. Kimberly Jarvis's research focuses on the culturally entangled practices and gendered roles that have marginalized consequences for women's sexual and reproductive health. She explores and addresses these concerns within a Canadian and sub-Saharan African context, employing both critical and participatory approaches to affect change in healthcare practice and social policy research. Please help me in welcoming Drs. Solina Richter and Kimberly Jarvis with conducting qualitative research in an international context. Over to you.
Thank you very much. It's a pleasure to be here, and I'm just going to start sharing our screen and then we can start. Thanks. So thank you for the lovely introduction. It's very nice to be here. So we've been introduced. So I'll just move to the next slide. And we will each talk a little bit about our backgrounds and our research interests. So I'm Solina Richter. I'm an immigrant to Canada. I moved here approximately 18 years ago. I did all my nursing and my academic training in South Africa. So of course, that probably is the reason why I'm so interested in doing international work. Well, it definitely contributed to that interest. So I've worked at the University of Alberta for 18 years and the last few years as the Associate Dean of Global Health. And I recently moved to Saskatchewan as the Dean of the College of Nursing. And I'm here now for approximately 3 months. My research interests are very focused on vulnerable populations as previously presented. So focusing on the social determinants of health that inform frontline practices to protect and promote the health of low socioeconomic populations, and specifically women. So my current projects relate to the focus on better understanding maternal health, how people within and across cultures share the same understanding of health and what it means to be healthy and practice in practices for maintaining health. So I'm going to hand over to Kimberly to introduce herself.
And I'm just going to jump in. Solina, I think you want to put your PowerPoint into full screen mode.
Okay. It
Thank
is
you.
actually, I think. Sorry. Is that better?
We're currently seeing all of your notes as well.
Oh, that's very strange. I don't know how to do that because it is on. I'm just going to stop share and share again. Maybe.
Yes, please. Thank you.
Is that better?
Perfect. Thank you.
Okay. Thank you, Kimberly.
Okay, thank you, Solina, and thank you for inviting me to be part of this. So my name is Kimberly Jarvis, and I'm an assistant professor at Memorial University in Newfoundland, Canada. And so my research has really focused on sexual and reproductive health of women, and very interested, as Juliana has mentioned, around the cultural and gender aspects of it. My interest in this really came about from my time that I have spent in the Middle East, working there, and some time that I have spent in Ethiopia, which led me actually to continue on to do my PhD at the University of Alberta, and then my postdoc. Currently, I'm working on, continue to work on projects around obstetrical fistula with women in Ghana, and also around adolescent friendly sexual and reproductive health resources for youth in Ghana as well. So that's my areas of interest.
So today's focus will be on practical and ethical considerations when conducting international research, challenges and rewards, lessons learned, and example from our international fieldwork. So both me and Kimberly are doing extensive work in Ghana, but we both has also worked in other countries. And because of my background, I draw a lot of students with an international background. So I've supervised multiple students from different countries. So I had a student from Rwanda that has looked at the prevention of mother-to-child transmission programs to prevent the transmission of HIV. I had another student from Rwanda that worked on teenage pregnancy in refugee camps. I had a student from Nigeria that worked on internal access to reproductive health care for internal displaced women because of the Boko Haram terrorists. I had a student in Ghana that worked on experience of perinatal loss. I had a student in Pakistan that has worked on urban Pakistan Muslim women's experiences of midlife or menopause. Then I had a student also from Pakistan that looked at facilitators and barriers to breastfeeding practices of internal displaced women. And then, of course, Kimberly was one of my ex-PhD students for, I think you've finished now for about 4 years, and she's done really a wonderful study in Ghana related to the reintegration of women who have experienced obstetrical fistula. And she probably will talk a little bit further about that. And then I have multiple other examples, but so I have a rich background working not just in low socioeconomic countries, but also I previously worked in Sweden, Germany, in the UK, and of course in South Africa. I've done some work related to my interest in homelessness. So some of these photos on the slide you will see is from photos that has been taken by myself and Kimberly, and also from some of my students. And we'll probably refer back to some of the photos as the presentation continues. So I'm going to hand over to Kimberly to talk about the next few slides.
So I just wanted to kind of really briefly just kind of set the context for our presentation and just talk about just briefly about international research, in that just to really define it, in that this is research that is really carried out between 2 or more countries, often with the purpose of comparing responses between them. And this can be done in order to devise strategies that work well across both of these countries, as well as to look at cultures, or to look at how maybe adjustments in global strategies might need to be, like I said, adjusted or changed. I kind of mention about, or want to define what international research is, because oftentimes when you go to the literature, you'll see international research and you'll see global research. And so these terms are kind of used very interchangeably, but, it does, I think, impact upon the type of research that we're doing. It does have implications for it. So I just kind of wanted to make note of that, and that the type of research that both Solina and I are involved in is certainly international research, but certainly has a focus around global health issues, because once upon a time, international research was only considered around infectious diseases or maternal child health, and certainly we explore issues well beyond that. So you can go to the next slide there. So the importance of qualitative international research. So I think that there's a lots of importance and significance to doing this type of work. Certainly for anyone who does qualitative research, we know that context really matters. Qualitative research certainly takes into account the natural context in which individuals, groups and families and communities actually function and look at real world problems. I think it's really easy to see how the world is very interconnected, certainly given our present situation with the COVID-19 pandemic. But we can, there's been in our history a number of things, certainly the economic crash in the late 2000s. There's been epidemics, pandemics, prior to. And so it's very easy to see why qualitative research would be very important. We certainly have limited resources, and we need to be sure that we're getting it right the first time. And part of that is certainly having a good understanding of the context prior to implementing interventions. we can go on to the next slide. So, of course, then what is our role? Our role as nurses, being that Solina and I are nurses, and for other healthcare professionals. Of course, I think we have an ethical responsibility to be doing international type research. And I think that the Sustainable Development Goals certainly address that, because embedded in that is the social determinants of health. And this certainly takes an approach of needing collaboration and partnership, as goal 17 specifically speaks to that, and that we do need to be having teams of all health professionals, but even beyond that. So, having engineers, policymakers at the table when we're talking about doing and conducting international research to really make a difference, because it's, at the end of the day, it's really about decreasing inequities and improving health and well-being of the population.
So I always believe you have to do really good homework before you consider doing any international research, and particularly qualitative research internationally. So things that you have to consider is weather conditions, and you have to plan according to the weather when you will travel to the country you want to do the research. So I'm going to use examples from Ghana. This photo was taken there, I think, just after the rainy season. You could see that the environment is probably inaccessible. So me and Kimberly has also been in northern Ghana, where the temperatures was close to 50 degrees. So everything is slower. You have to plan for time and the space where you will do the research. And also, but very important is to consider weather and then traffic and road conditions. Also, how will you get to your sites? Consider if you can travel there on your own, or should you have a person with you? So really, really good planning is extremely important. And then also safety is of the highest importance. So look at local guidelines. So we constantly, when we do international qualitative research, also look at guidelines that comes from Health Canada related to not just safety or activities that might make the environment unsafe, but also health issues that might be prevalent in the area that we do our research. So during one of our visits to Ghana, the Ebola outbreak happened in West Africa. So really to consider those type of things. So again, come back to really good planning is extremely important. Then of course, language, and Kimberly has already talked a little bit about that, is one of the most important considerations when you do a qualitative research internationally. So I've come across this beautiful book and I can afterwards send you the title of the book, but it talks about the silence of language. So it talks a lot about the cultural aspects, the things that we cannot hear, but what you have to see. So it's talk to one another without saying a word. So observation is extremely important when you do qualitative international research. So you have to observe what's going on. And of course, our interpretation of what's going on might be different than what is really going on. So remember, we will always be an outsider. So important to, after a session of collecting data, is to go back and write down reflective notes of your interpretation, and also go back to your team and share your reflective notes. Very, very, very important, and your observation. And one good example was I went with Kimberly once to collect data, and when the participant came, she went right down on the ground And I just wanted to pull her up, but that's the norm in their country when they greet you. They just go right down on the ground. So she was sitting on the ground while we were doing the interviews, and we were sitting on chairs. So afterwards, I had to really reflect on that and how it made me feel. So the reflective notes are extremely, extremely important. So I always say you cannot really do qualitative international research if you don't understand the context in which you are doing it. You have to understand the political and cultural systems in which you are conducting your research. And then I will go with the type of work we are doing. Very important that you understand the place of women in society. And I'm referring, and Kimberly will probably talk a little bit about that when she talks about the ethical considerations. In many countries, you cannot interview a woman without having her husband or an elder or another male person with you. So, and then the question comes up around the ethical considerations. That is very important. And then the concept of time and the concept of space is so different when you do this type of work. You also, what I recommend is that before you do this work, to learn a few local phrases. It opens doors, like if you can greet them in their language, if you can ask them how they are in their local language, and then also in some countries you get a local name depending on in which month you were born. So if you can use that name and introduce yourself according to their cultural or traditional names, it opens doors, and it just builds that trust and relationship. Again, time is important. You have to slow down. Another thing that we've experienced, and I didn't in the beginning, I just thought we're going to use translators. So we were so lucky that we had access to grad students in some of the countries we are working. And then we started realizing that when they do the translation, they actually just give us a summary of what the participant was saying. So it was more like interpreters. So how I've overcome it in one of my studies is that I did a few interviews with the translators and the interpreters, and then I trained some of the grad students to do the interviews themselves in the local language, and then we had it translated later. And it really worked better than me conducting all the interviews. It was more time consuming for me to work through a translator, and my participants got tired because you use about double the amount of time when you work through a translator or an interpreter. Then another consideration that is pretty important is that technology doesn't work always the same as in Canada. So you have to make sure that you have proper backup systems when you record, and you cannot rely on technology. We've also worked in quite rural and remote areas, so important to consider that when you plan. Then when you do your interviews, just to come back to that, I always say, and you work through a translator or an interpreter, is to sit and look directly at the person that are interviewed. And your interpreter and translator should sit type of outside that circle and not talk to the translator, but talk to your participant, although you have the person that are translating that, what you've said. So that is quite important. Yeah. So I'm going to ask Kimberly to give a few examples of metaphors that people are using. And if you translate it directly, it doesn't mean anything to us. But so that's why I wanted to demonstrate how important it is that you understand the culture and the language that people are using.
Okay, actually, just before we get to the examples, I just wanted to mention too, for the methodology, I know that I've had experiences of going to Ghana with in mind a particular methodology. and it didn't always work. So I just want to mention too that certain methodologies, it's really important to speak to or talk to whoever you've partnered with in the country. I know for me, I was looking at arts-based research. We did actually in the end up doing it, but it wasn't something that they were familiar with doing. So it's also important to be, collaborating and really talking about how the research project is going to play out. And if you have the capacity to actually be able to do the particular methodology that you're proposing for your project. So to get back to just the examples that we have here related to language, and this was really even speaks to the analysis of the data. This is actually some of the quotes that came out of some data that I had. And I had to really kind of go back and you can imagine reflect on what some of these things actually meant. So the first quote that I had gotten was that the lizard does not eat pepper for the frog to sweat. Now, I mean, I understand, this is in context of kind of what I was talking with the participant, but this actually going back and, looking at it, continuing to have discussions with the participants and the cultural broker that I was working with, is really speaks to responsibility, personal responsibility. So the idea that the lizard or the person, he can't be the one to eat the pepper and then for the frog to kind of get the benefit from it. And so this was in the context of my work with women with obstetrical fistula. So basically, if they want to be cured, they have to be able to do the work to be cured and, to follow the protocols that were in place for them. This one here, one finger cannot lift a thing. This was a husband actually of a woman that had an obstetrical fistula had said this to me. And so it was really about the family unit and the community. And he was saying that it wasn't just him alone, that it would take the entire community to try to, make things right. To help this woman to be able to reintegrate back into the community. In Ghana, of course, it's a very communal society. And so it's very difficult to be able to live, as an individual or even as a family. It does require, communal support. And so that's really what he was speaking to there. And then the last quote was, a tortoise who has no clan has already made his casket. And again, that's really about the sense of community in that, again, if, in Ghana, it's very challenging to live as an individual. You have to be able to be accepted, back into the community. And so many women, talked about that. And I know initially when women or families were, speaking, I guess, in this way, I didn't quite understand, obviously, initially what they were saying, but even why they were doing it. And I came to understand, as Solina said, you need to try to read as much as you can about the culture and just, have a good understanding. Of course, I'm not Ghanaian, so I have to acknowledge that I'm not, or, whatever culture that I'm going into and know who I am as a researcher. But there's so much learning. So you need to be so open to that learning. And just to realize that there's not everything that you're going to be able to, to know. So now moving on to the ethical considerations. First of all, I just want to say about, about the gatekeeping, in that you do absolutely need to have someone that you're partnering with in whatever country that you decide to work in. Any type of international research does not work otherwise. You know, you have to have researchers on the other side that are invested in the project as well. I mean, ultimately, these are the people that are going to be, you know, helping you and getting you access to participants, to organizations, to supplies, whatever it is that that you need. So they need to be included really right from the beginning. They need to know what the objectives are. They need to know what the benefits are. These are individuals that are really putting their reputation on the line for you. And so you really need to be very upfront, just especially if you're, I mean, it would be unethical not to, but certainly if you're wanting to go back to, you know, that particular country, you do need to be very upfront, let them know your intentions, and you don't want to make promises that you're not able to make. So that kind of speaks there to even to incentives for participants. It would really be unethical to say, you know, that you, or make promises about the type of research, you know, that you're doing. So you really, if there, you know, if there isn't anything specifically that's going to come out of that, that's going to directly benefit them, you need to be able to say that. Sometimes even picking out geographical areas of where you want to do your research, you need to be really careful. Of course, some people, or some geographical areas are a little more economically deprived than others. And so how do you pick or choose which one you want to, or, you know, go to? It definitely has to depend upon, you know, access to the participants, but also your ability to be able to get there. Because oftentimes, of course, participants do get some small incentive. And so you will find that everybody wants to be chosen to be interviewed. And so you can kind of get yourself in a little bit of an ethical dilemma there if you're not careful. So you need to be certainly aware of that. When it comes to consent, you know, consent can be done in many ways. For many people that I have worked with in sub-Saharan Africa, they have been illiterate, and so have not been able to consent in terms of writing it. They're able to put an X and have someone to witness it. But sometimes consent is just, you know, verbal consent, and I just have to make kind of note of that. I do ensure that consent is, or, you know, it is explained, the study, in their local language, and that they do understand what it means that they're consenting to. Oftentimes, it's very difficult to get consent for women in particular, because in many of the societies, as Solina has mentioned, they're very, you know, they're patriarchal. So, you know, women are not able to sign in some cases for themselves. And so a husband, sometimes a village chief, needs to be involved. And so that kind of leads into the whole idea of the privacy and confidentiality, and has been something that I have certainly struggled with. Coming from kind of a Western ideology of what these terms mean. And so I've come to really understand that privacy and confidentiality really means different things in different places. And it's really made me have to reflect on, you know, what is ethical and what is unethical. And, you know, the whole idea around cultural relativism, you know, in some cultures, it would be unethical to ask someone, you know, to leave while someone is being interviewed, if culturally that's, you know, what's appropriate. I know many of the ethics review boards, certainly, you know, in the West, are very clear about how things need to be done for ethics. But, you know, ethics can be different in different places. And so I've had to really go back and rely really on the Declaration of Human Rights and look to see, you know, what that actually says in terms of autonomy, and like what that, you know, what does that mean for an individual? You know, what does, you know, do no harm actually mean? I also just want to mention when it comes to ethics review boards, it's really important. Oftentimes we have to get ethics, in our institutions, but we have to get ethics in the the sites in which we go and, abide by their rules. I have recently really struggled with my latest time, even in understanding, if we're doing research in another country and their outcome is different than, say, in the West or in my institution, who gets the say there? I have felt that sometimes it's almost kind of a recolonization of that we're not really respecting the ethics review boards of the countries in which we're visiting in some cases. I also just want to mention with consent that consent sometimes can be difficult because we don't know the age of participants. People sometimes just, they don't know their age. And so you do need to really be cognizant of that, ask some questions maybe around, when you were born, who was president of the country, to try to figure that out. And at the end of the day, you're really going with kind of, it's really sometimes a bit of a judgment call. People do appear older and certainly wiser because, many people have kind of have lost their innocence in some way in that, they work really hard. And it's just a different context. And then the last thing I just kind of want to mention is about the receiving gifts from participants. Again, ethics review boards would say absolutely not to this. I know in Ghana, I apologize for using that as an example all the time, but it's kind of what I'm most familiar with. But receiving gifts is something culturally that is expected if, a guest comes to your home, that you give them a gift. And so, I've been given many gifts from, guinea fowls to goats to yams, and, have graciously taken them. And so to do otherwise really would have been a lack of respect for the culture. And so these are some of the things that you kind of need to think about. I think ethics looks very different in other places, and not even just in Guinean or an African context, but in other Western societies as well.
Thanks. Yeah, so I just want to emphasize again, like our colonial views, we cannot impose that on the context or the participants we're working with. So really important to consider that. So the next is leaving the field. So Kimberly was so privileged that she could stay for 7 months to do her field work, but of course not all of us have that privilege, and I'm one of the persons that don't have that privilege to stay 7 months in the field. So really, I think you need to have a time commitment when you do qualitative international work. I always talk about the helicopter pilots, that helicopter in, collect their data, helicopter out. They use the westernized way of interpreting the data. And quite often you present the work not in the context that it should be. So again, coming back to really have local people on your team, and the ideal is to do the analysis with your local researchers to make sure that you interpret the data correctly. And then what's very important is your knowledge dissemination. I know in our context, in North America, it's important that we publish in high impact journals as part of our process to get tenured and get promoted. But quite often you have to also consider what is the audience, or who is the audience that you want to reach. So it might be that you'll publish in articles or in journals that is not so high impact, but you will reach the correct audience. It's also important to take this data back sometimes to the community or to your local researchers and do community presentations and also work with the local politicians and policy decision makers. Extremely important. So something that I've experienced in much of the work that I'm doing, and I call it trauma to the researcher. And I know my colleague, that one of my other colleagues, that's an anthropologist, just talks about leaving the field. So you are quite often exposed to things you are seeing that is shocking. And I remember clearly how it affected me and how I had to, again, use my reflective journal, write down how it made me feel sometimes, and questioning my own intentions of doing this type of work. Very, very important. And then to think of reverse culture shock when you go back to your country of origin. I remember the first time I came back from doing some field work in a low socioeconomic environment. I couldn't buy a cup of coffee because many of the participants I've worked with was living on $1 or $2 a day, and here I'm spending $2. I remember it took me about a month before I could buy a cup of coffee again. So just really be aware of your own feelings. Use your reflective journal often, and the ideal, like I said in the beginning, is to stay in the field, do your analysis while you are in the field, and work with your local researchers to really be true to the data that you've collected. So important then, I'll just go very quickly over this slide because I want Kimberly to talk about the next slide a little bit more extensive. So be open to learn from a new culture. Capture the words and ideas of participants, and again, make sure that you interpret it correctly, and constantly being aware that you are an outsider. If you stay for extensive periods of time in another country, you start feeling like an insider, but you will never ever be an insider. So constantly being aware of that is very important.
Okay, so just about some lessons learned, and hopefully it can provide you with some examples. First of all, I would just like to say that, doing international work is such a wonderful and privileged, really, experience. And I think one of the most, for me personally, the most positive thing is about, well, a couple of things actually, would probably be like how well I have come to know myself, but also to be able to learn about other people and to help me to be able to see things through, other people's eyes. It's just such a wonderful experience. And so I think that kind of really, in some way, probably speaks to cultural humility in that, going there, I assume not, I know nothing kind of thing. And I don't go in believing that, my education or where I'm from is, going to kind of solve problems. It's really learning from the people that I'm working with. And I think some of that probably comes from my participatory kind of approach to things, but it's just such a wonderful experience. I've learned so much even around what is family, and when you look at people who probably have, say, much less than, say, people in Canada or the US, but yet have so much more in terms of the richness of what they understand family to be in some situations. As far as the philosophical considerations, there are obviously a number of, frameworks, theories, and models which we can use to build our research. Many of them, of course, are founded in, Western ideology. I mean, that's really what we learn, I guess, to a large extent when we're in school. But we do need to realize that, like religion, spirituality, myths, superstition do play a role in other cultures, and we need to take account for that, in other places. Language, as we've seen, plays a big role, metaphors, parables, and it shapes the reality of, for people. And so we really need to be looking beyond kind of Western philosophies and looking to, philosophers in other countries or other, models of how to actually do things. There's a picture there about the square peg in the round hole. And so I have very much felt that when I have been, in these countries trying to do work and trying to use, my Western philosophies to try to make things work, and it just doesn't. And so, I've had to go and to look, have had to read a lot about African philosophies. Ubuntu would be one, but there's many really great African philosophers, and I'm sure I haven't looked at ones in say Asia, but lots of them. And so we really need to be drawing on that work. Examples as well, relational inquiry. There's, like I said, no way that you can do this work unless you're communicating, building trust. You have to kind of acknowledge the whole idea around the colonization within certain countries, and kind of clear that elephant from the room. And then collaboration and partnership is really again really important, and whoever it is that you're partnering with in the other country has to have a stake in the research as well. I know, particularly when I was doing my PhD work, because that had to be kind of an individualized project, I really struggled. And reflecting back on that, not that I didn't have anyone to collaborate with, but they really didn't have a stake in it in terms of, they weren't on, say, the grant application. And so, people need to feel they're really a part of it. And I can really see the difference now that I'm kind of doing my own work and working in teams. It does really make a difference.
So I've added our contact information, and you're more than welcome to contact us if you have more questions. So we can move to the question and discussion session. And I haven't, Juliana, checked the Q&A box yet.
And that's okay. We have more questions than can be answered in the time that we have. So it's good that you've put up your contact information. And actually, if you want to bounce back to that slide, people can note that. I'm going to choose a question from many from one of our participants and bounce just between Q&A and chat. One question that covers a lot of issues: how do you arrange pre-site visit training to get all on board for methodological alignment?
Pre-site visits.
Pre-site training.
Oh, pre-site.
So
training.
pre-site visit training to get all on board for methodological alignment.
So we are very lucky that we have a quite extended team now in Ghana. So we rely very much on them. We also employ local project managers that are more to train us on this side than the local people. So we, in our grant applications, make sure that we can afford a local project manager that can work with the pre-training before and attend to the ethics application and those type of things. And because I've been traveling hind and forth quite a lot, I had these contact and relationships with local people that is easy to contact them. And we've prepared a very large grant, so we met at a distance about every 2 weeks, Kimberly, and I think just before the grant went in every week. So very relying on the local people that's on the ground and acknowledge their knowledge of the local context is very important. I don't know if you want to add anything, Kimberly.
Just to add that, certainly doing international research, it is kind of time intensive in that, obviously you just can't decide to just, up and up and do it. It does require that relationship building. And so I know the very first time that I went to Ghana, I was there for quite a while before any research ever even, took place. And this last time that I was in Ghana, it was similar. I was there for probably, I don't know, almost a month before we really could kind of get things moving. And this was, and I bring this up because we were actually wanting to do, an arts-based research project, and we were kind of, we were getting some resistance about how that would act or what that would actually look like in a, within this context. And so it did take a lot of, kind of talking back and forth. And in the end, we ended up, myself and another colleague, actually running a 3-day workshop for researchers and research assistants to get them comfortable with what art-based research was, what it would look like in a, in the context, and then how it would actually be delivered. That was as important for trying to get the methodology. I mean, that was what it was written in the proposal, but also ensuring that, it was going to be conducted properly.
Very good. Thank you both for that. Bouncing now to a question that came in through chat. What should I say to my field respondents in qualitative research before leaving the field if I'm not sure whether my research will actually bring some helpful real life implications or not?
Very good question. So I think just as we do here in Canada, we will tell them this research might not benefit you individually, but we hope in the larger context it will bring about changes and policy changes. Very hard to make promises that it will have a direct impact on them as an individual, but I think just to emphasize that in the larger context, we hope it will make life better for them. Kimberly, I know you I think came across that question quite often.
Yeah, everybody asks, how is this going to benefit me? I do, I've gotten lots of requests, even when I come home to Canada. My voice messages is always, requests for motorcycles and, all sorts of things, because of course, in some places people think that you can come and you can bring, all sorts of things. So you really do need to be very clear about your reasons of why you're there, and what you can actually deliver. I know one thing that I did feel very responsible for, I think, as a researcher, was a lot of people had said that they wanted me to go and talk to the government about the issues and to create change. And I really felt that as a researcher doing, the particular type of work that I was doing, that I owed, my participants something. And it was more than probably, just writing papers or policies. Not that I promised anything, but it was something that kind of really weighed very heavy on me. And so when Solina talks even about trauma, certainly I think, you see conditions or things that need to be changed. And I think it's hard. I mean, we're researchers, but we're also human beings too, and you want to try to create change.
Yeah, so in that context, we have good relationships now with the UNFPA, the United Nations Population Fund, and we feed back the knowledge that we have to them, and they also navigate some of our research that we are doing. So I think in that sense, it's really bringing about change, but we cannot make any promises to individual participants. It's unrealistic to do that.
And unethical.
Yeah.
We have so many comments and questions flowing in. I'm going to ask Dr. Richter if you can put the name of the book You mentioned early in the book on language and culture. If you can put that into the chat, that will be helpful for people. We have a question that came in early regarding the presence of men during data collection with women where culture or local law requires it. A few questions, I'll quickly read them off. Were participants able to share personal experience in those contexts? And to which extent were they able to divulge information? Also comparing that to similarities in working with children. How do you manage to get the data collection you really need in those kind of contexts?
Sorry, Kimberly, you have to answer that now because I'm busy typing.
Okay.
I didn't get the whole question.
Well, I mean, to be honest, I mean, I don't know that you truly know that you do have what it is that you what you really want. You can only ask the question. And I mean, even I guess if a man wasn't there, people are only going to tell you or give you whatever it is that they feel that they want you to know. I do understand what you're asking though is that does that actually impact what you would actually get? And I know that was my concern as well. For data, maybe they're not seeing the whole story, or maybe they would tell me something more, if their husband wasn't there. But within the context, there's really nothing that you can do about that, because culturally that's kind of the way that it has to be. So to ask them to leave wouldn't. But having said all that, I know sometimes too that I know in Ghana for sure, there's a lot of women groups, like a women leader. And so sometimes I would go to her because she certainly has a, kind of a pulse on what's kind of going on too. So sometimes there's underlying ways that you can kind of check and kind of validate some of the data that, or, some of the things that you're getting back. And so there's sometimes other ways to kind of go around trying to get things. I don't know if that answers your question.
It's a huge question. So thank you for taking a stab at it. And again, I'm really glad that you put up your emails and are willing to continue that conversation. That particular person did have a number of questions that we won't be able to cover all of. However, bouncing back to another comment and question, loved your comments about the challenges related to ethics and consent. Please say a bit more about the differences in ethics process in the countries where you work and the countries where you are employed.
That caused a lot of stress with me because and I had multiple discussions with our ethics board, so I think much more training needs to be done. But Kimberly has written a paper on phronesis, on practical wisdom, that I think we if you email me or her, we will able to give you that. But Kimberly, I think you can it's just the way people are interpreting, like Kimberly said, what is consent, what is confidentiality, what is privacy. And one example that from Kimberly's work is that she wanted to interview women with obstetrical fistula in a certain village, but you first have to go and get consent at the informal leader of the community, and then everybody knows why she's there. So there's nothing like privacy are interpreted differently. Kimberly, I'm going to let you continue talking about this.
So, like as Solina is saying, it's just, I think it's really the language around, what some of these things mean around privacy, confidentiality, around, consent. I mean, the process is certainly, the whole process is just really different, even in terms of, what you have to submit to ethics review boards, in other countries, and what they feel even is, ethical to study and what's not, even just recently going and looking at adolescent sexual reproductive health. We really felt that was going to get through ethics very easily in Ghana, and it did actually in Ghana, but here in Canada, we struggle to get that through ethics. You know, people were really concerned around issues of homosexuality, like issues that were not issues for the Ghanaian context were coming up here in Canada. And so sometimes it's just context, it really does matter. And
I think it comes back to what Kimberly previously said, is our colonial view of what ethics are, and that we cannot inflict it in these communities or environments that we are working. And I think people don't understand that. And it's more taking it back to human rights and not the ethics so much, I think.
Yeah, I've had to really go back and not look so much at, you know, ethics review boards and what they want, although I know I'm bound by, you know, by those guidelines. And I know, you know, when I've looked at, I know like Aristotle, for example, talks a lot about practical wisdom, and, you know, he talks about like making these columns, you know, but of course rulers are straight and the columns were round. And so how do we do that? Well, obviously you need to kind of bend the ruler a little bit to make it work. And so I don't want to suggest that you bend the rules of your ethics review boards, but you do need to go back and you know, really look at the Declaration of Human Rights. I mean, that's kind of where, you know, ethics review boards, you know, kind of, you know, these guidelines came out. I mean, they are guidelines. And, you know, what is ethical in one situation and not ethical in another? It's a really big discussion, I think, that needs to be had with, you know, ethics review boards and lots of universities.
So we are actually at time and have many other questions that people had fielded. I'm going to encourage people to please do check our International Qualitative Research Toolkit archive. We'll have the slides available on the archive along with the video. I can't thank Dr. Solina, Richter, and Kimberly Jarvis enough for this engaging, wonderful presentation. Thank you so much with your busy schedules to take the time today to do this. We've had such interesting discussion and feedback. I'll be trying to send you the questions as well, just for your consideration, both of you. And I've just shared our next Insights in Qualitative Methodologies, our qualitative methods research is Dr. Robert Kozinek's Immersion in Social Media, the Ethnographic Path. That's on November 30th. I encourage people to register and attend. And again, thank you to ATLAS.ti, to Indiana University, to the University of British Columbia, obviously, the School of Nursing there as well, and to both of you for this wonderful, and of course, to all our attendees. Thank you so much for attending, and we look forward to seeing you again. And again, please do check out our archive as is noted here. Thank you, everyone.
Bye-bye.
Have a wonderful day.
Thank you. Bye-bye.
Bye.